Yes. Welcome, everyone. Welcome. It's been a while since we've been live on here. We are on Facebook and we are on YouTube. We are coming to you live to talk about the first Connecticut Nurse Wellness Summit. This has been something we've talked about for a very long time. So I just want to take a moment to introduce myself, even though this is my page. But my name is Wendy Garvin Mayo. I am a nurse practitioner by training, also the CEO and founder of Collaborative Cancer Cure and the Stress Blueprint. I'm all things stress management, emotional intelligence, mental health. And I would love to have my guest, not really my guest, I guess you are my guest because it's my page, my guest, introduce herself.
Oh, you are so funny, Wendy. Hello, everyone. Thanks so much for having me join you on this. So yes, I am Nakia Jackson, obviously a registered nurse background. I'm former ICU nurse, patient safety specialist turned nurse well-being strategist, and the founder and CEO of Holistic Health Coaching with Nakia RN LLC. So
Very
yeah,
good.
yeah. Also in the well-being space and all things, how do we make sure that we are prioritizing ourselves? Because that's
Yeah.
foundational. Yeah.
Yeah, and Nakia, this summit's kind of like full circle for me because when I first started the Stress Blueprint, which is all about stress management, emotional intelligence for healthcare professionals, I started the Nurse Wellness Podcast, right, which we are going to relaunch. So it's all about wellness, about nurses, but I think it's really important for people to understand how we met. You want to give a little story of how because you and I, we met and we just kind of meshed and we like joined, efforts, and now we are organizing the summit.
Yeah, it's just, I guess it's one of those like divine things when like your paths and stuff are aligned, like you start pulling the right people to you. So yeah, we met through a mutual colleague, Dr. Tina, who connected us. Yes, shout out to Dr. Tina, who had connected us and said, you women are doing some really amazing, fabulous things. Y'all two should meet. And then we met. We talked about the things that we've been working on, what we're passionate about. And I believe it was you that said, we should do a summit. Like, we should just do a nurse wellness summit. And I was like, okay, yes, let's do that. Because it aligned with so much of the work that you're already doing, the things that I'm already passionate about as well. So it just felt like this is like, now is the time for us to focus on this.
Yeah, and the reason I'm excited about this summit is because we have a lot of wellness nurses, wellness professionals in the state of Connecticut. And I think it's important that we actually do something, right? Do something collectively. So I look at this summit as a collective effort of all nurses in Connecticut. So we're bringing this to all nurses, right? Well, from all nurses to all nurses in the state of Connecticut.
Yes.
And we are truly excited to be partnering with the Connecticut Nurses Association, who's like our leader in Connecticut and all things wellness. But, it is a thing, right, Nikki? Everyone talks about wellness. Everyone talks about stress management. I think it's poo-pooed, but it is a really important topic.
Yeah, absolutely agree. I feel like wellness, and, we talked a lot, probably the heaviest is during COVID. It was like this, it was the biggest topic of discussion was like COVID all of a sudden, like it unleashed this, what's wrong with the mental health and why are we not talking about it? I mean, the reality is that it's always been there. I think COVID, if nothing else, it just shed a light on what was already happening underneath the surface. So to your point, I think, there is a lot of poo-pooing of wellness. And now that we've kind of, we've moved past COVID, we're post-pandemic. It's almost like the folks that we called our healthcare heroes are now like, it's just back to business as usual. Like you should just dust your shoulders off and just keep moving. So it's, the premise really behind this summit is to really empower nurses, because obviously, we feel it as well, too, as being in the profession and having been in the profession a long time, the importance of prioritizing your well-being. And I think it's, it's important that institutions also know this, but it's important as individuals, as nurses, that you have strategies and that you have things in place for yourself, that you are doing the things that allow you to care for yourself and be well. So that is really the premise of this. It is on an individual basis of what you can do for yourself, and taking some tools and strategies and a day to reset. Absolutely.
Yeah, and it's going to be an annual summit, right?
Mhm.
This is not like a one and done. That's something that Nakia and I were both, we definitely both connected on. Like, it's not a one and done, but this is a movement. I would say it's a movement, and I'm going to do everything in my power just to make sure it's sustainable, because it's so important. And I think we could do things in silo, but when we come together, it's so much more powerful.
Absolutely. I'd learned from the Connecticut Nurses Association that there's 55,000 nurses who are registered in the state of Connecticut who still, classify themselves, I guess, working in Connecticut. So that is a force within itself when we talk about the power of nursing. And nurses are still the most trusted profession, even after all these years. So it's like we can't just, just be put to the side and just like, okay, we just continue on like everything is okay. I think we have to be the voice for ourselves and advocate for ourselves. So yeah, to your point, Wendy, this is not meant to be a one and done. We're looking at this as a movement.
Yeah, and one thing, you said a couple of things. So organizations. So I think wellness, it's twofold, right? We have to do what we can do for ourselves to keep ourselves well, right? Because stress in life, like, what do they say now? Life be lifing. Cool thing to say.
So funny. Yeah.
But like we have to do things to keep ourselves well, right? But also organizations, wellness was a big movement. We had wellness directors, officers, departments, and a lot of organizations are doing away with that because of budget cuts and different things like that. But if you think about hospitals or healthcare institutions now, if there were no nurses in healthcare institutions, how would the health of our state be?
Yeah.
Right?
Exactly.
Yeah.
There would not be, you can't have a hospital without nurses. I mean, nurses are foundational to the business. And I mean, I know there's been, other discussions and policies, as it relates to reimbursement for nursing care, but I mean, that's a whole separate topic and discussion. But I do feel that, to your point, that, where would organizations be without nurses? And I think part of that is recognizing the importance that nurses bring. And I think nurses also using our voices to say like things that we are and we're not going to tolerate and do. So I think that makes, that's a big part of it as well too, is like when you have the ability to advocate for yourself, and that advocacy it happens in groups. So having groups that are supportive and that get it and are not just like, we're just going to go because that's what they told us to do. And we're just going to go that way. You have to be able to advocate for yourself, whether it's well-being and, and all the other stuff that relates to, to the job and work environment.
But one thing I always say is that we can't truly advocate for ourselves effectively if we are stressed, if we are burned out, if, moral injury, whatever you want to call it, right?
Yeah.
We're not able to do those things effectively. That's why I think wellness is a big part of that, right? And even us,
Absolutely.
You and I being in the wellness space, we still have to check ourselves and like bring it down. Like, okay, are we aligned? What are we doing? Right?
It's those reminders, because as you said, life is lifing. So I think in terms of like, we're not going to be able to stop every stressor in our lives, so it is important to be able to manage that. But back to what you were saying about organizations of, it is important. And I always say this, and I'm wearing a bit of like my safety hat in this too, is just it comes back to culture too, as much as we say, they put all these things in place of having these wellness officers and, and these titles, but you can put the title in place to say that I've checked the box. But if the culture is not aligned with that, if the culture is not supporting that, if it's just something that we're giving lip service to, then you just have people in these positions and in titles who are not really, it honestly is not up to one individual. It has to really be embedded in the culture. And that's where the change happens, is in culture.
Yeah. Yeah, and this summit is really all about that, right? I know
Mm,
it's Nurse Wellness Summit, but there will be some empowerment, some advocacy. I'm even, just from my encounters with a group of nurses recently, we got to instill some confidence in there because, as nurses, we are brilliant individuals. And I'm not sure
girl.
about you, but no, I'm sure about you. I'm sure about you.
Girl, yes.
But nursing school was
Yeah.
tough, right? It's
Yeah.
it's not like you don't buy your degree. We worked our
No,
tails off of those
you
degrees,
do.
and
Absolutely.
we want to be there. So you brought up COVID, and one thing I really admired about our profession is that we still showed up regardless, right? And that really just showed the dedication that nurses have to the profession, to patients, and specifically, we're talking about Connecticut now, like across our state, like
Mm,
all of our nurses were showing up, right?
absolutely.
Stressed, scared, but
Hmm.
patient care was at the forefront of that.
Yeah.
So we have
Yeah.
to ensure that we are making we have that nurses are sustainable, that they don't
Yeah.
have stress, they're not burned out, there's no moral injury, that they are overall well, so they can do the job effectively.
Yeah. Because to your point, like those are the things that are so like wellness is not just a perk. And I think sometimes
Hmm.
it gets into this like, oh, it's a nice thing to have. Like, oh, it's cute that you can do that. We'll give you a little, but it's foundational to any
Yeah,
organization. Like if your people, so if you think about the people who are caring for the people, and obviously we're speaking specifically about nurses because we're nurses and a little bit biased, but it's all good. But if the people who are caring for the people, in particular nurses, aren't well, aren't doing the things that they need to do to be able to care for themselves well, then all of that, what they're bringing, that stress, that lack of tools and resources, they're bringing all of that to the patient and the families and also their colleagues that they're working with. So it's like that is foundational to your organization, to your business. Like the well-being of your workforce is essential. Like I said,
yeah.
it's foundational to any of the work that you're attempting to do and how you're attempting to grow. So prioritizing that is, yeah, it's not a nice to have. It's a must.
Definitely, definitely. Nakia, what can they expect at this summit?
Yeah, so there's some good things happening. So Wendy had alluded to like having some leadership talks about what's happening in the state of Connecticut as far as the workforce. So those will be some discussions, but it really is an opportunity for nurses to develop some grab some tools, maybe some tools that they don't have, learning some new things. We have some people doing a multitude of facilitating some wonderful workshops related to yoga. We have some people doing some qigong, some sound healing, some opportunities for just learning some different like mindfulness techniques, meditation, also offering some self-defense on the other end of that as well too.
Yes, we need to
So
talk about that.
yeah, so there is a variety of stuff, but also tools again, because it's having, having these tools that you can kind of, go back to, but also some discussion and some mindset talks about, how do we move forward so that there isn't just what stays here at the summit. So what do we, how do we, once you leave the summit, what are the takeaways for you there? So it is meant to be not just a one and done, but how do you continue through work and just through life, because it's not
Yeah,
just work skills, but it's life. Because as we said,
yeah.
life is life. And
Absolutely. And you said two things. So you said like mindset. I think people poo-poo mindset as
mm,
well. But the important thing with mindset is shifting our behavior. And it
mm,
starts with how we shift the way we think about things. Because many times we're in a routine, it's habitual how we think, how we do things, or how we don't do things.
mm,
So that mindset is really important for us to really lean on. Because if we're trying to create culture shifts or behavior shifts, you have to have a mindset shift first.
absolutely.
And then
Absolutely.
you mentioned something about self-defense, which I'm really excited about that because violence has been on the rise
Mm,
in healthcare. And my hypothesis is that it's related to stress, right? The COVID stress,
absolutely.
society is
Hmm.
stressed. Nurses are dealing with society, and it's coming from all angles. It's coming from it could be verbal or nonverbal violence from coworkers, leadership, but patients, even physical abuse. And I'm sure
Mm,
you're seeing it online where nurses are
yeah.
being assaulted.
Yeah.
So that self defense, that's going to be wonderful.
Yeah. It all goes together when we're talking about just, wellness and well-being, and the how to care for yourself in all aspects. So it certainly just tails right into to what when we talk about just wellness. So excited for all of those. And it's going to be such an amazing day of, connectedness. I mean, the other big thing about this is a sense of community, as we were talking about, in terms of advocacy. And it's extremely important when you when you feel like I'm not in it alone. Because I think for many of us, I know even with my own journey, part of the struggles were, sometimes you feel like, it's just me, like I'm just the only one. Well, the reality is like, no, you start sharing nursing stories. Sometimes it's like, oh yeah, I experienced that too.
So
that sense of community and support, not for us to stay and stuck in our stories about what isn't working, but how do we, understand, we recognize, what happened, but how do we then move to the next, and being in that supportive community. So excited about really building that. I think from this summit is going to be inspiring. So inspiring.
I love it. So all of you who are watching the replay, register for the CT Nurse Wellness Summit at summit.ctnursewellness.com. And we are so excited to see you there, see you in the room, see you and your colleagues in the room.
Yeah. And if you're watching this and you're not a nurse, I was going to say there's also a way for you to still be able to support. So if you want to sponsor a nurse, you can also email us at hello@ctnursewellness.com.
Sounds good. Sounds good. Well, this has been a great live. I love it. And this was not scripted. This was right off the cuff. So I love it. I love it. Just a genuine conversation.
Just us chatting it up, girl.
Absolutely. But we'll be back tomorrow to talk about some more nurse wellness tips, talk about the summit. And we'll love to see you there. So register summit.ctnursewellness.com. And until tomorrow, be well.
Yes. Take care, guys.